Hello, everyone. We've started our webinar online, so welcome to the many people that are online for today's George Talks webinar. We've got quite a few people here in the room, very timely being for World Food Day that everyone is getting their lunch. So certainly when you do get your lunch, come and sit down and certainly enjoy that. My name is Matt Cross. I'm the Head of Government Relations and Stakeholder Engagement at the George Institute, and I'll be your moderator for today. I'd like to, of course, start with an acknowledgement of country, and we acknowledge the traditional owners of the land, the Gadigal people of the Eora Nation, and we pay our respects to elders past, present, and future. And this land was and always will be Aboriginal land, and certainly for you people online, certainly acknowledgement to the land that you're on as well. Well, it gives me a great pleasure to welcome you all to this George Talks on, I think, a very appropriately named Food is Medicine. And of course, it is World Food Day on Sunday. As much as I would have loved to have had an event on Sunday, we've decided to do it today on Thursday. And we've chosen the topic, Food is Medicine. So our three panelists today, we have Professor Jason Wu, who's the Head of Nutrition Science Program at the George Institute. Give a wave. There we go. This is interactive online, of course. We have Jed Mads, who's the Strategic Health Partnerships Manager at Diabetes Australia. Welcome, Jen. And we have Tristan Harris, who's the co-CEO of Harris Farm Markets. So welcome, Tristan. Yes, give a round of applause so people online know we have a great audience. To start this very interactive session, I'm just going to stop sharing the PowerPoint and I'm just going to share a Menti screen. It's always great to have, oops, wrong share. It's great to have some interaction as we start, especially for anyone here that is online. Bear with me. So all of you can see that Menti screen. If you go online to menti.com, we'll give you a moment there to go on. And if you put the code in 68182165, and you can vote. So we want to start, the question is, what percentage of adults eat the recommended fruit and vegetable daily intake? I'm actually shocked that no one's hitting 75. Wow, everyone's pretty pessimistic. We'll give you just one more moment. So I designed this question with Jason. Jason, would you like to explain what the answer is?
5%.
Unfortunately. Well, we'll talk certainly about that when we hit the panel discussion. But no, thanks everyone for taking part in that. Maybe I should have put a 1% or a 0% or something to make it a bit more competitive. Yeah, interesting, no one said 75%. So I'll just share the screen and I'd like to invite Jason Wu, who's the Head of Nutrition Science here at the George Institute, to really set the tone about the concept food is medicine. So over to you, Professor Wu.
Thanks very much, Matt, for that intro, and really nice to see everyone here. Just like to especially welcome Jen and Tristan. Thanks for joining us today as well. So yeah, given that it's World Food Day coming up and so much of our work here at the Institute focuses on nutrition and health, I just want to talk about one area of work in particular where we've been doing a lot of work and doing a number of studies and showing some pretty promising results that I think has a real tremendous potential to try and transform the way that think about nutrition and health within our healthcare system. So I always start with this slide because I just think it's really important for all of us to think about why we do what we do. Why do we think about nutrition and food and health? Globally right now, every year, about 11 million people die prematurely because of essentially a poor diet, right? So eating too much of the unhealthy things, not having enough of the healthy things. And this was a paper that was published in the Lancet in 2020 by the Global Burden of Disease Study, where in this graph here on the bottom left-hand side, you can actually see the individual risk factors which they looked at in terms of their association with things like heart disease, strokes, type 2 diabetes, and certain types of cancers, right? And we know these NCDs are the top killers and account for about 75% of deaths globally every year. And what you'll see is that the number one ranked risk factor is a diet that's high in sodium. Will not be surprised to most people who work here at the George Institute. And but then if you look at the next four things down, four risk factors down, so diet low in whole grains, diet low in fruits, diet low in nuts and seeds, and diet low in vegetables. So these are all components we've all been told we've got to eat more of because we know they're good for our health. And yet clearly globally, we're failing to do that because they account for a huge amount of the disease burden. We often focus on premature mortality, but it's also really important for us to think about every time someone gets a heart attack or stroke, that's lost productivity, that's a lot of families who's emotionally suffering from having that lived experience of having had a heart attack or stroke. And in terms of our economy, the amount of hit that we take from these kinds of diseases is also just tremendous as well. So I'll jump straight into this innovative concept around food prescription. Now, I've just said that all of us have been told, you've probably been to your doctors and they might have told you, look, hey, you need to think about your diet, right? You think about doing more physical activity. But unfortunately, currently in our healthcare, that tends to be where it starts and where it stops. Sure, you can get some consultation, referrals to dietitians, and government reimburse that to an extent, but it's pretty limited, right? And all of it is sort of predicated on the idea that if we just told you what to do, if we just gave you that knowledge, gave you that education, you'll be able to act on it, right? It shouldn't be a problem. But in reality, we know that it's not the case, and particularly for vulnerable and disadvantaged communities who may experience issues of accessibility, affordability. So food prescription really is trying to sort of tackle that issue head on, right? So right now we spend billions of dollars every year subsidizing and paying for things like statins and beta blockers, all important life-saving medications. But why don't we actually put some of those dollars through healthcare to subsidize and pay for healthy foods and meals? And doctors can literally just, when they talk to a patient and they say, look, we've had a discussion, you're experiencing food insecurity, let me tick that box for you, and you can take that script down to local Harris Farm, for example, and pick out some healthy produce that's subsidized. Sounds crazy, but not really, right? So in the United States, these programs are fully in place already across many states. I've just given a couple of examples here. On the left-hand side, it's a program that's up and running, being piloted in the state of Massachusetts, which is where Boston is. $4.5 million being run out of the local, one of the local hospitals, and they're recruiting patients to essentially giving them a debit card, which they can then take to the local grocery store or farmer's market and use it to redeem for healthy foods, right? And they're evaluating the potential health impact of these kinds of programs right now as we speak. On the right-hand side is the other sort of common food as medicine interventions that's in place right now. So these are sort of takes the concept one step further to say there will also be community members who, even if you gave them the ability to purchase produce because of their physical or mental health issue, for example, they may not be able to put together healthy foods, right? Cook a meal for themselves. So the medically tailored concept just says we're going to actually design these meals from scratch, and then, with nutritionists, with dietitians, and then they're going to be tailored to your specific medical conditions, type 2 diabetes or hypertension, for example. And then these kinds of programs are already fully covered under the Medicaid program, which is a state insurance program in the state of California. Breaking news, just 2 weeks ago now, I think, the Biden-Harris administration in the US have just convened, I think, their second ever hunger, nutrition, and health conference, where they put together a strategic document on how to lift America as a whole to tackle the issues of hunger and nutrition and health. And one of there were 5 pillars that were put into the strategic document. And pillar 2 was integrating nutrition into health, and food as medicine interventions will be a big part of that strategy, including, I've just outlined the text there, they're considering essentially expanding both Medicaid and Medicare, so that's the National Federal Insurance for older people, coverage to cover these kinds of programs. So things are going full steam ahead in the US. I won't have a lot of time to get into the sort of details of some of the work that we've done in this area today, so it'll be a bit of a whirlwind tour, so just bear with me. The first study that we did is we conducted a systematic review and meta-analysis. We wanted to think about, can we get these kinds of programs happening in Australia? I think we should, but how are we going to go about to do that? What are the program designs? How do people roll these things out in different countries? And what are the evidence for the impact on diet and health? So we conducted a systematic review and meta-analysis. I won't go into detailed methodology, but in essence, that we found about 13 studies available globally, and overall the body of evidence suggests that these participation in these kinds of programs reduce experience of food insecurity, improve people's diet intake of fruit and vegetables by about 1 serving per day, so about 20% increase, and participation led to reduction in important biometric outcomes like glycated hemoglobin, weight, and BMI as well. But the flip side of that is that most of these programs to date are small pilot scale studies, not a lot of randomized controlled trials, so not quite yet giving us that sort of gold standard evidence that we normally require in this sort of setting, but it's promising. We've also now conducted a produce prescription feasibility study, working with colleagues at RPA Hospital, right across the road from here, from the George Institute. Tristan and Harris supported us in running this study. What we did was that we recruited 50 individuals with type 2 diabetes and also experiencing food insecurity. Over the space of 12 weeks, they each got delivered weekly a healthy food box that we put together and designed based on the Australian dietary guideline that we know is going to be helpful for supporting people's management of their type 2 diabetes. And it was just a pre-post intervention study, and we did a lot of interviews with the participants, with the healthcare providers, again, just to get a sense of what do people think about these kinds of programs. Again, not a lot of time to go into details, but overall what we found is that, I've just summarized in this one slide here, participation in the program led to substantially improved diet quality. So we saw that there was about a 1.7 per day increase in servings of fruits and vegetables. Their whole grain intake went up, nuts intake went up. But what was also really pleasing to see is that the intake of the less healthy foods in the diet, so your sugary beverages, red and processed meats, decrease in the diet of these participants. So really showing that I think by supporting them with access to these healthy foods, they were able to make healthier changes to their dietary pattern. One thing I forgot to mention is that we did also provide dietitian consultation fortnightly to the participants. So acknowledging that nutrition and education is very, very important, supporting the behavioral change is very important, but also at the same time, I think having the food boxes really was a boon for the participants. We also saw some fantastic changes in terms of loss in body weight, so about 1.7 kilograms over 12 weeks, and improvement in the blood lipid profile of the participants. I won't go into the deep dive into the findings. We can come back to talk to that if others are interested. But again, I think this just shows that even in Australia here, I think these kinds of programs are popular with patients with at least type 2 diabetes. We have some promising evidence again to suggest that can be really, really helpful in their clinical management. But again, we need to start to think about how we can do that large randomized controlled trial, and also co-implementation with actual healthcare providers to say, what would this look like? What are the existing programs and governance and funding bodies that could actually step in and fill that gap right now in terms of supporting these kinds of programs? One last thing to mention, we are doing a full randomized control trial in the United States run by Kaiser Permanente, which is one of the largest private healthcare providers there, on exactly this program that I've just described. So, but I think we also need Australian specific trials for that context to see how we can get it to work here. Last slide. We also have an ongoing randomized controlled trial looking at medically tailored meals. So you'll remember in my initial part of my talk, there's sort of these two broad programs, one around subsidizing paying for healthy produce, the other one around pre-made existing healthy meals. So we are actually running a RCT right now. It will involve about 200 participants from the Sydney metropolitan area over the coming couple of years. So hopefully we'll be able to share those results with you sometime in the future. So I'll stop there and pass it back to Matt. But yeah, I think this program overall has great potential to really transform the ways. I think of it as a paradigm shift to get doctors and our healthcare providers really starting to walk the walk and more, rather than just sort of talk the talk, and pushing the system towards that direction and being able to prescribe and supporting people access to healthy foods. Thanks very much.
Well, thank you very much, Jason. And it's just great to have the scene set about what today is all about. For those people online, there is a chat or not chat, a question and answer option. So certainly when you're hearing things from the panel, certainly do put a question in and I'll try and potentially get it answered. We will have about 20 minutes of just a panel discussion now, and then we'll open it up to all your questions. So whether you're online or in person, think about the questions and we'll get to them. So I'll just give our panelists a microphone. Look, I'll start, I might start with Tristan. I want to start with a broad question. I mean, what does food mean to you, particularly as a business owner?
As a business owner that sells only food, it is my entire life. It's my job, it's my career, it's my passion. I love cooking. We talk about, in the business, we talk about good food and the good things it does for people. Our business purpose is the greater goodness, and we have sort of settled on that because we can keep coming into this. Natural food is just, it brings people together. It makes people healthy. It is kind of the core of most of our cultural activities at some point. And so food to me really is just about everything.
Jen, coming out as a dietitian, what does food mean to you?
Same as what it means to Tristan. I guess, being a dietitian, I have more of a kind of a clinical therapeutic lens on it as well. And there's a lot of applications that food has for different purposes. And one of those being a clinical setting, but the other being performance as an example. But I guess the bigger picture of what food plays as its role in all of our lives is that it brings us together. And irrespective of whether that's, performance or clinically related, it has a purpose to really bring and connect people together. So that's from a dietetic perspective. I guess I can put it down to that theoretical level, but at the end of the day, it really does come down to bringing everybody back together again.
Right. I won't ask you, Jason, what food does mean to you, because I know how passionate you are, but where did this concept of food as medicine come from very much a medical research point of view?
Yeah, so I mean, we've had strong evidence from all kinds of research, basic animal, large observational epidemiological studies, and large randomized controlled trials that has essentially definitively proved, diet is one of the most important factors towards our health and well-being. And yet, again, going back to my first slide there, what I showed, clearly there's a massive bridge between where we should be and where we currently are, right? And that speaks to the issue of we need to shift our entire system, really, our entire food system, our entire society towards a direction where healthier choices become the easier choice, right? Whereas things as they are configured right now makes it very difficult. And the food as medicine idea is really just one component of that, where I think people are starting to realize that there's a real opportunity for us to leverage the healthcare resources, because we spend as societies, a huge amount of our government dollars into healthcare. Most of it currently on treatment. Most of it currently is in that detect, diagnose, drugs paradigm. So I think people are starting to realize that we need to shift the focus into thinking about prevention. So we can't treat our way, drug our way out of this mess. We need to think more upstream. So I think that's partly where the food as medicine push is coming from. And I'll also just say one other thing, which is really important, is that especially over the last few years with COVID, with the war going on in Europe, the costs of living expenses have really shot up, and that has pushed a lot of community members into economic insecurity and food insecurity. And we talk together that we need to tackle the issue of equity in health. And I think that's again where this concept of dedicating and directing these sort of support to people who need it the most can play a role in addressing that equity problem.
Thanks, Jason. I've got a question online, but it's also a question I want to just touch on from your original presentation, Jason. It's a question to Tristan. So online it says, it's from Natasha, I think no pun intended, but it says, what is the appetite of leading supermarkets to get behind such an initiative of food as medicine? Jason touched on that doctors are prescribing healthy foods. just like they're already prescribing medications. So it's almost this concept of instead of going to the chemist, you'd be going to the supermarket. So Tristan, why is Harris Farm behind this, and how does other supermarkets get further behind it?
Okay. So the reason we do it, we're in a very lucky position. We're a family-owned business. Our name's up on the door, and so we want the business to represent us. And I would say we want it to represent the best parts of us. And that is a benefit that we get out of not having to answer to other shareholders. So a social benefit for our business, we see as a benefit for ourselves, and that's a benefit to the shareholders. So we can get away with that. That's not necessarily the case for the larger listed supermarkets. And we'll see what their appetite's like, because I introduced both of them to Jason, and so he's hit them up for funding for this for the next part of the trial. I'm not sure what the commercial sort of outcomes will be for them. It's possible that it could be designed such that they are able to benefit commercially from it, in which case they obviously support it very closely. And I think the important thing for me is that there is government backing of this, because anything that relies on just someone's well wishes, and this is good for the sort of community, at some point you get an economic squeeze and it gets deprioritized and then it falls off. And so that's why I was so excited when speaking to Jason about the prospect that this can be the government says, there it is, we're going to fund you to go and buy healthy food. That to me is a brilliant outcome, and that's the one that I think we really need to be chasing for.
No, thanks for that. I mean, Jen, as a dietitian, and hearing that about government wanting to get involved, because clearly, budgets are spending a lot of money on treating chronic disease. Jason mentioned prevention. I mean, how should we be looking potentially in that way of governments prioritising prevention in health? And are you supportive of governments playing a greater role in prevention?
Absolutely. Although I think we need to look at it from a whole systems approach. You can't just find a solution for one area and then expect it all to trickle down. Our health system is very reactive, as we've kind of mentioned, and our funding model is very reactive, and it's very volume activity based. And so in order to fix the situation in one area, you have to kind of fix it from the top first, for that then to kind of trickle down into the food system. One area that we I guess can look at is the subsidy and the regulation of particular items that address health and not just prevention but also management of conditions, and one of them being, for example, the MBS and the PBS. So from a federal level, what is it that we can do to introduce food as being part of those programs? So we don't necessarily have to change or I guess create new ways of funding, but it's about, well, how can we be innovative with the ones that we've currently got to introduce food as being medicine?
So keeping on the theme of government intervention, we're talking about governments basically encouraging people to do the right thing. We've got a question online just about a sugar beverage tax. So that's, I guess you could say, you're punishing people or trying to encourage them not to buy sugar through tax. Jason, what's your view of governments going down that path?
Yeah, can I just come back to that in just a second? I just want to first just say something to what Tristan mentioned before. So the discussion with Woolies and Coles is ongoing, so I won't say any more about that right now. But I think in the US, you're already starting to see that positive feedback loop, in the sense that the government is getting behind it. So a lot of large food businesses are saying, how can we help, right? Because they see this as a commitment. There's a multi-year commitment from the Biden-Harris administration, and they're saying, we're serious about this. So then they're willing to come to the table and say, okay, let's make it work. Because, I've sort of simplified the presentation a lot, but as you know, this is implementation science, right? Like when we were doing the trial together, being able to order the food get it on time, making sure that when things do run out on the shelves, having something ready to substitute. It requires an entire sort of infrastructure to go with this concept of produce prescription. So I think, but I do think that there is that sort of positive feedback loop if we can get it, some sort of commitment from the larger funding bodies. Now, sorry, back to the question about
government involvement, I guess, in using the taxation system.
Yeah, so I mean, to me, it's a no-brainer. We already tax tobacco, we already tax alcohol, because we know that these kind of products are harmful towards public health. Sugary drinks fall right in that bracket. It offers no nutritional benefit. It basically is just a product that harms people in society. So using fiscal measures to essentially tax it, raise the prices, to drive that signal so that people stay away from it. And in many jurisdictions as well, very often these kinds of taxes are then associated with subsidies that would then go towards healthier foods. So you can really get that one-two punch, if you like, in terms of driving people away from the less healthy and towards the healthier things. And numerous modeling studies have shown that those kinds of interventions will be an investment. So when governments put through those kinds of legislations, they end up saving money in terms of the overall healthcare costs. So you get win for people, win for government, and I think so they should be done.
Jen, what's your view?
I would have to say that I think the crux of it is that you do need to have the two things working at the same time. You can't just tax and expect that money that they save is going to go towards prevention. And in a lot of the cases, it doesn't happen, or it goes to somewhere which isn't effective. So I don't think one can work without the other, and it's a catch-22 in terms of how much is invested and where it goes after you actually get that additional money from the tax. So everybody's in their own situation, and they have a choice to play in their own diets and what they want to put into their own bodies. And I think as part of that, they need the education that goes behind that. And even to Tristan's point, you kind of need that environment. It's a whole of systems approach to make those healthy choices easier choices. The taxing is only one area of that.
Tristan, I know from a commercial point of view, fresh food does not get GST. That's I think a good thing. But what's your view, especially from a commercial point of view, and knowing your customers, if what would encourage them, I think, to buy even more fresh food?
If I knew the answer to that. I think as Jason said before, just telling them that it's good for them doesn't work. And changing the price does to an extent. However, we've just been through a period with the sort of March, April floods in Queensland. We ended up with fruit and veg prices that were well beyond anything we've seen before. And we had a small drop off in consumption of fruit and veg, not a massive one. And so I suspect if we tax sugar, we'll get a small drop off in consumption of sugar, but not a massive one. I'm not a policy guy, I'm a business guy. So one thing I would say is if they were going to do it, it would take a hell of a lot of time to design something that was really simple, because GST is a bit of a nightmare in terms of the complexity of it. So you don't want to tax the consumer for having sugar and then saying, oh, but orange juice is a healthy product, so we want to take it off that. And then all of a sudden you've got all of this work going into, and you add a cost burden into the businesses. And so all of the funds that you're sort of making on one hand are being chewed up on the other hand by businesses trying to comply with the tax law.
Right. That was sort of tackling, I guess, in some aspects, cost of living, which is clearly a really big issue. Another really big issue, I think, in the electorate is climate change. And Jason, I've got a question to you just on about the food system and how that actually impacts the planet and impacts emissions.
Yeah, so again, this is unfortunately another one of the sort of not so great aspect about food system right now is that globally the production of food contributes to around about 25 to 30% of greenhouse gas emissions. A lot of that obviously is associated with livestock. So we know that consuming red meat is one of the major, sort of drivers of in terms of our own dietary patterns towards that greenhouse gas emission. So it's very clear that we need to, again, get on top of the sort of food system transformation. Isn't just going to be good for our own individual health. It also has the potential to be good for the planet's health, right? And in terms of dietary guidelines right now, most of them I think do get it right. In terms of the focus is on you don't have to be a vegetarian, but it's important to consider a mostly whole plant foods based diet. That is the foundation of what you eat. But we do currently, as a society, I think, consume way too much red and processed meat. And so again, if you're looking for something that's going to be good for your personal health and also support the planet, because you can then use that demand side consumer-driven approach to say we need to sort of shift away a little bit from so much of this livestock and red meat production and more towards plant-based foods.
And Jen, how does people's diets not only impact their health, but also the wider planet?
Well, it just comes down to what they're selecting, really. And I guess, all the emissions that comes off of that. We just got the release of, I guess, the draft carbohydrate guidelines from the WHO. And I think, as part of that, one of the areas that they're focusing on is plant-based proteins. So getting more legumes and getting more peas and lentils and nuts and seeds. And so as part of that, it's around, well, if you want to do good for the environment, then it's about, doing good for your health. And the way that we can do that is to eat more plant-based food. So it's coming out in every guideline these days, just to eat more plant-based foods. So.
And Tristan, from a social corporate responsibility or social license view, how have you, in a business sense, thought that climate change needs action, particularly as a family-owned business?
Yeah, climate change is, I think, we spend so much of our time answering questions about plastic packaging, and we keep trying to shake sort of the consumer's view and say, plastic packaging is not really the issue. We could be 50 times worse in plastic packaging and still live. It'd be terrible, but we'd still live. If we let climate change keep going, we're all going to die. So let's keep our eye on the ball. We're resetting our sort of climate targets at the moment. And I think there are some really exciting things happening in the agricultural space. There's too much money tied up in meat production and dairy production for them to let that go completely. They have to innovate and find ways to reduce that impact. And so there is actually now some very exciting stuff with regenerative agriculture and a view that at some point in the future we could get an agriculture which is certainly far less impactful on the climate, but potentially even with a zero total emissions. We will also no doubt see a lot of interference run by the dairy industry and the meat industry. Some of it will be designed deliberately to obfuscate the view of what is right. Someone showed me the other day that if you measure the greenhouse gas emissions per litre, dairy versus plant-based, then dairy is far worse. But if you measure it as a greenhouse gas emission per nutrient, I don't know how they calculated that, but that in fact, then it switches around the other way. So that kind of information / disinformation will be really hard for consumers to read. And so we think, and even for a business owner to understand. So we think our role is going to be to help try to reduce everything that we can reduce. And we think probably then provide the best information we can and the simplest system for somebody to shop and understand their own impact. And so I imagine that at some point in the future, you will be able to print out your docket at the register and say the emissions that are associated with what you're part of it. So the scope 3 emissions for us, which would be the scope 1 emissions for a person consuming it, is going to be X, and this is how you would offset that or reduce it. And then people will be able to see the bits that are adding lots of carbon to their own footprint. I think that kind of information thing is where we will be able to, as a business, make the biggest impact. Because at the end of the day, our scope 1 and 2 emissions tiny compared to our scope 3 emissions, in particular when it comes to something like beef, which is, you know, it's single-digit percentages of our sales, but 30% of our total carbon emissions.
No, that's amazing, using innovation. Yeah, Jason.
Thanks, Tristan. We just need to fix the offset system too in this country, then that'll help too. To that point about consumers not having the sort of information to be able to judge and trustworthy information, I think that's actually one of the programs of work that we've just embarked on here at the George Institute. So we have an existing food switch program, which we've talked about before, where we hold already the nutritional information for about 100,000 products here in Australia alone, and then millions around the world. And traditionally, we've really used that to push for that. You know, you think about your individual human nutrition impact, right? So things like the health star rating, which is not currently mandatory on label, but we can provide that information to consumers through the Food Switch app. We're actually now in the process of introducing carbon emission for individual products that are in the Food Switch database. And the idea is the same, is that we think consumers have the right to have a trustworthy source that's scientific based, that they can access at a glance when they go shopping. So I think that that's going to be a really important part of the work going forward in terms of providing that information for consumers so they can think about what's going to be good for my personal health and potentially the planet's health as well.
Yeah, I'd like to just give a plug to Food Switch. How many people here have Food Switch downloaded? So that's pretty good. If you don't, there's an app, type in Food Switch. The great thing is, as you go shopping, not all, as Jason said, not all products have a health star rating on. So you get Food Switch, you basically scan the barcode, and it will actually give it all the nutritional value, as well as, yeah, the exciting times of being able to now look at just beyond the nutritional value. I think you can also look at salt. I'm looking at Fraser, who lists Food Switch. Yep, you've got salt, sodium. So yeah, certainly do download it. I want to open to the audience, either online, but yeah, certainly out there. So Helen, I'll come around.
Thanks, Matt, and thanks to the panel. That's a really interesting discussion. I've got a question for Tristan. I'm a Harris Farms shopper, and my 16-year-old daughter works there, stocking your shelves as well. But I was just wondering if you had any strategy or policy around things that you won't stock. So thinking about kind of ultra-high processed foods or other items that you don't stock or won't stock.
We already do, and there's lots of them. Where to land on that so that we are, I mean, we're not mass market, but we're still in a broad market. So we have to be careful not to be too niche. I mean, you know, there's a lot of health food stores around, and we feel like that is too niche a space for us to play in. I guess this is something that I'm probably not supposed to announce at a place like this, but we've actually removed all artificial colours from the whole business, and we finished that with Vegemite, as it turns out. It's got an artificial colour in it, which really shocked me. But we took out all MSG, we took out all artificial colours, and we're slowly sort of working our way through what do we think is going to make a real difference, and what do we think is going to be a way of signalling to the market that we are looking at our product. And it's definitely not easy. Like, you take a category like Asian food and try and take out all of the artificial colours. And in fact, we took out, in that for a while, we took out artificial colours and preservatives and flavours, and the category got decimated. There was nothing left. So we would have nothing left to sell if we did that. There is a hell of a lot of work to go, and trying to maintain a database like Food Switch is extremely complicated. So trying to know what is in each product at any one time, and then making sure that you've got all of it out is difficult. But we don't stock many sort of carbonated beverages, and I think the biggest challenge for us is trying to define what to keep out, because that is that changes over time for a start, what the commonly held sort of view is. And we just sort of do the best we can to keep a healthy store. And I think, you know, most people would acknowledge that by and large, it's a healthy store, but trying to define that's really tough.
Yeah, having a private sector involvement in this concept is, I think, really encouraging. We've got a question from Jane Martin online, and it's to Jason. So this idea of supporting healthy diets in practical ways, isn't this something that the Australian health funds should have an interest in?
Yeah, definitely. So, you know, we've had some initial conversations with some of the private health funds in this space, again, just exploring potential for partnership and for them to potentially introduce these kinds of programs for their own members, because again, they know full well that every person that lands in the hospital, you know, because of a diabetes and having a foot ulcer and amputation, that is, from a purely business sense, really, really bad for their bottom line. So I think there's definitely interest among some of the private health funds to think about, you know, if we're able to divert some of our, you know, support for the members towards these kinds of healthy food programs, you know, could we actually prevent them from getting that sort of complications in the first place? So yeah, I definitely think that's another potential growth area where essentially around the sort of the wellness and keeping members healthy is sort of the other route where I think there could be some resources that we could leverage.
And working with stakeholders clearly is really important. And so Jen, just a question to you, because your title is the Strategic Health Partnerships Manager at Diabetes Australia. How are you working with stakeholders, and are there, any surprising stakeholders you're working with?
Surprising stakeholders. I guess, you know, my role itself is across the whole health system. So that's from federal down to state, down to local. A lot of my work is with primary healthcare networks, and within New South Wales, there are 10 of those. And there are different community groups within each of those. And so there's no real one solution that is going to fix all of their health problems. Each community has its own chronic disease cluster, and we need to find a specific solution for that. If we look at, I guess, the state as a total and the amount of our state, which is in kind of like an arid desert area, regional remote areas, they're the most hard hit. And I guess, you know, to Jane's question, can private health insurance companies get involved in doing programs? Yeah, they can, but our priority groups don't actually have private health insurance. And I think we need to turn back to the government to try to fix the system or even supplement the system to really have an impact on those community groups. So a lot of, as I said, my partnerships are at that local level, really trying to find solutions, not just, I guess, as a chronic disease, as diabetes that I represent, but as a total well-being type of program that can actually prevent a lot of different chronic diseases.
Do we have any questions from the audience? Yes, I'll come to you.
Hi, the question is for Jason. You said you were going to do a randomized control trial. Isn't it unethical to do a randomized control trial? I'm just asking because I don't know. Because everyone in the control group will benefit from the same food tray, and that's what we learned in public health studies, that running a randomized control trial in public health is kind of unethical.
Yeah, so to answer that question, I mean, in terms of the design of the trial, the control group do get some incentives. We do give them food shopping vouchers that they can then go and use, right? To exactly that point, that their participation, they do need to benefit from their position in the trial to an extent. But also, I guess, on a larger level, I don't think it's a ethical issue here, because the status quo is that there's the current healthcare system, which is the doctors will say go and do X and Y and Z, but they don't get any actual sort of physical support. So I think it's not we're not concerned about the sort of the ethical issues there, although we did take that into account by providing some levels of support for the control group as well. We don't tell them what to do with those vouchers. They're free to buy whatever they want to. Yeah.
Any other questions? Yes.
Hello, Jason. I have a question. I like the concept of food is medicines. In your opinion, are there any challenges to let the public to accept the concept?
Yeah, so I mean that's a really good question. I mean, certainly, you know, if you think about it, there is the perception that is this just another sort of welfare program, right? So that can get sort of stigmatized in that way in some ways. So I think going to Jen's point, I think it's actually incredibly important to consult with the community that you're working with in terms of, is this something that is acceptable? Is this something that they can get behind? And I think we always need to do more of those you know, kinds of listening to the community that we're working in sort of work. So that's probably the main issue I would say, because for example, in a program in the US, they do use a debit card system, and those cards are tied to certain kinds of foods, and those can often, you know, for some consumers that do, I guess, arouse a sort of feeling of like, am I just on welfare? Am I sort of just getting a support that I need? So I think those sort of issues can be dealt with though, in terms of, again, consulting with the community and designing the program in a way that is framed as this is just like medicine that you will get from your doctors, right? In the sense that we do, right? We give people medication. So this is just another one of the treatment options that you can have access to, and we think will be helpful to you.
So the theme of World Food Day on Sunday is leave no one behind. So that's quite a powerful slogan that makes us all think. We got a really great question online from Jennifer saying that millions of people around the world know what they should be eating, but they choose to seek comfort in the wrong types of foods, in sugar, salt, and fat. So how can we deal with this psychological issue? It's a really good question. So tying that in with the slogan for World Food Day, leave no one behind. Tristan, I'll start with you. You know, especially in Australia, you being a local business here in Australia, how do you make sure that people, I guess, aren't disadvantaged from their cost of living or socioeconomic experience?
I am probably the worst person to ask on this question. All of my stores are east of here, except for there's one about 100 metres that way. This is, I think, part of the issue that I was referring to before. We support a very small supermarket out in Western Sydney with incredibly low CEFA scores, and we donate fruit and veg to them so that they can use that to draw customers in and give it away and help the food insecure out there. That relies on us, having a philanthropic view of the importance of the issue. And it will, if the business goes into a period where it's going to be difficult, it becomes difficult for us then to continue to do that. So I don't think that that's the answer, and I don't probably have the answers other than the type of program that Jason's proposing.
And Jen, I hate to say it like this, but is it that sadly some people have got a chronic disease in some aspects? They had almost no other option in that they didn't actually have a choice to make over many years. So how can we change the system so that, yeah, no one is left behind?
It's a very moral question in that, is it the chicken or the egg? And I think, there needs to be a cultural shift in the way that we think about food and the way that we use food in our lives. I was using an example just earlier on around, what's the association you get when you go and watch a football game? And if you were to ask a little boy or, even a little girl, what would it be? It would be the food that they get at those venues. And what is the food that they get at those venues? It's a meat pie, it's a hot dog, it's chips, it's, sugary drinks. And I think it's that cultural change that makes the choices so difficult when people become adults, and it just becomes perpetual and it's a habit. I think that needs to be a focal point on changing behaviour, which can then lead to healthier healthier behaviours, and then hopefully a reduction in avoidance of chronic disease later on in life. So do I think we're leaving people behind? I think that if people, you know, were brought up in a way that our cultural norm was to go to the Harris Farm or the local providor, or to, you know, even the local community garden, and get their food as, you know, being whole foods, and we ate more that way, that we wouldn't be in the predicament that we're in.
Jason, yeah.
I'll just quickly add to that. I mean, I think it's a really interesting question, and I think this point of, in some ways, people being brainwashed by multinational corporations into thinking what is normal or what isn't normal, I think it's an issue that we need to get on top of. I mean, Jane Martin probably knows the stats on this, actually. The amount of dollars that you know, confectionery and junk food makers spend on advertising, one stat that I do know in the UK is every year the top 15, I think, confectionery and sugar drinks makers spend 150 million pounds on advertising their top 10 products. The equivalent government spending on healthy eating promotion programs is 5 million pounds. So a ratio of 30 to 1, right? So I think in some ways it's not surprising that people, you know, I guess that the audience is asking it as a choice, but I also question whether is it really a choice, or is it just something that we've been acculturated to because of, in some ways, the influence of you know, marketing on us.
Mm-hmm. Any questions from the audience?
Hi, I'm Milena from George Clinical, but have a background in nutrition and pharmacy. So thank you so much for your presentations. It was so inspiring to see food and prescription in the same sentence. Amazing what we're doing in George Institute. And my question is really, so people, they sometimes know what to eat. They see that they need to have whole grains and fruits and vegetables and plant-based protein, but they go to the shop and they say, okay, I change everything today. I'm going to eat healthy now. They bring all this amazing food home and they go, now what? So I think there's an important component of how to use this. It's the same thing when you get a prescription and doctor tells you how to use it in the morning, in the evening, whatever, food without food. So I have a lot of people that I teach how to cook and do things properly as well, but there's a lot, like a big component, because just people don't know how to put these things together. So I was just wondering if there's a component or initiatives like that to teach people. Thank you.
Yeah, thanks for that great question. So for both the feasibility study that we ran here and also the trial that we're running in America right now, it's actually exactly to your point. We don't just provide the boxes. We actually also put together recipe cards that were tailored to what's provided in the boxes. So we had a few different options. I mean, it's obviously not possible to individualize to every person what they want to order, but we did have a number of varieties. For each of the boxes, we had a recipe inside, actually several recipes inside to use the foods. So it is sort of like the HelloFresh concept, right? And then, as I mentioned before, we also do have fortnightly dietitian consultations. And really, Kathy is probably the best person to speak to this. She did our qualitative evaluation for that study. It was really quite mixed, right? In terms of some people really loved that. They loved the fact that, exactly to your point, oh, I've got lots of ideas you've given me about what I'm going to do with the foods that are in the boxes. Others said, well, you know what? I've always just wanted to cook. I know how to cook. I just can't afford to buy healthy, fresh produce. So I think, you know, again, it won't be one size fits all. I think for some people, those kinds of education and support and just useful material really will be very, very important for these kinds of interventions.
Yeah, Natasha Online just thinks about the role of the education system. Look, I can say hand on heart, I can't cook. No one really taught me. But even more so about cooking what's good for you. So Jen, what role does education have to play?
Look, even if you look at policy and what's happening in schools at the moment, there's so many challenges. One being the school canteen system and the policy that they've got. You know, our facilities in school canteens are just a heat serve type of environment, and now they're forced to provide healthier options through the healthy school food canteens policy. I think, you know, there's so many limitations in trying to change and shift that. In order to do that, you really need to take out the food business that a school canteen is being labelled as, and really look at how we can get people to come together at tables, you know, use a knife and fork as an example, rather than just open up a package and eat it from a paper bag or a piece of plastic. There's that aspect to it, but there's also really great programs that are working really well in schools. And two that I, you know, have in mind is the Crunch and Sip and the Munch and Move. Both of those programs are around taking a break out for whether it be kindergarten or preschool children and those under the age of 5, and giving them some time to have some water and some fruit and or vegetables, just as a, you know, a break in the day. And that's increasing their fruit and vegetable consumption. Why don't we do that in workplaces? You know, we've got some fruit boxes, why don't we do vegetable boxes? It kind of changes over time. And I think, you know, that's only primary school that those programs are being run. What happens once they get to high school? There's a discontinuation of some of those really great messages that come through in primary school. And by the time they become adults, they've lost those habits, and they're down at the local train station or bus stop, and they're buying the hot chips or, you know, whatever it is, the sugary drinks on their way home and or to school. So I think, you know, there's a real place for policy in schools to start to educate people, but also create healthier environments for people to be around, to really make those healthier choices easier choices.
Tristan, do you have any comments around education? Particularly, you might want to share some of maybe your experience growing up in the family business. I mean, the products you deliver are very healthy. So is it, where did the whole Harris Farm sort of concept, I guess, come, and what did it mean for you growing up?
So Dad started the business back in '71, and we, from the moment I can remember, we had fresh orange juice every single morning. And we had, you know, porridge in winter, and then, you know, a couple of wheat bix in summer, and lots of fresh fruit always. And we always had, you know, Dad would bring home a tray of mangoes every single week during the summer, so we always had that. We always had, you know, lots of and you know, avocados, which are now sort of very common. You know, back then were a bit scarce, and we always had them around. So we just naturally sort of got the advantage of knowing that. I don't see how that is possible for the average family, and so I think programs like Crunch and Sip, as Jen mentioned, are fantastic. Trying to design them and stuff like that, not something that I'm even capable of imagining. We tried to do some of it in the. I was on the board of the sort of the peak fruit and veg body in Australia, and it almost impossible to sort of, I guess there's one systematic problem that we've got, and that is that nobody owns fruit and veg by and large. You know, there's some varieties that some companies own, but by and large, fruit and veg is, you know, 1,000 farmers and you know, going through a bunch of different retailers. So the increase in consumption doesn't hit anyone's bottom line. And that's very different from the sugary snack provider who, you know, they can go, yeah, we'll provide 1,000 samples and we'll do some advertising and stuff like that. They'll drive that up. That incentive, that economic incentive, is not there for a fruit and veg player.
Well, we're about to run out of time, but I just want to go to each panelist just one more time and just, I guess, say just final thoughts or your final message or something you'd like to leave us with, so when we walk away from here, we will remember something. So Jason, final thoughts, final message on World Food Day or Food as Medicine concept.
Yeah. One thing that I was going to say before and I didn't touch on was that, you know, we're talking about the issue of food production and its impact on the climate. But obviously the climate also goes the other way. And I think Tristan touched on that in terms of I'm a dad to a young boy. He's 21 months old. And there's one thing that keeps me up at night is climate change, right? Because it literally will kill us all if we let it run amok and destroy our very ability to grow food. So I like to challenge all of us here to think about, you know, every time you go out there and take some personal action on climate action, you're also helping us in terms of contributing to food security and our ability to keep looking after ourselves and our planet for future generations. So thanks.
Jen, your final final message?
Yeah, look, I would say go out and actually take the time to utilize the day to share food with others. And also, I guess, go around and look in your community and actually see what is out there. On my way over here, I saw a macadamia tree, I saw an avocado tree, and I saw a lemon verbena plant in somebody's front porch. They're the things that our children these days aren't getting, I guess, awareness of. And if we can bring some interest to food in people, even if it's one small little spark, it then brings them closer to eating a healthier way.
I'll pass the birdie to Auntie Jen. I'm sure the trees are-
Tristan, final thoughts other than we should go shopping?
Yeah, 25% off today. No, my thoughts are much like Jen's. I think what I'd love people to leave with is go and reconnect with the natural joy of food. Food is amazing. It's so joyful, and if we can do that, and that is what causes people to be, I think, more thoughtful about their food. And if we spark that joy in our kids, they also become more thoughtful about their food. And we build the food culture that, as Jen mentioned, that's what we need, as a culture around food where people understand it, look into it, care about it. That's when we'll be able to move the needle, I think.
Everyone, put your hands together for our great panel. We'll look out in the next few weeks for our next George Talks. But for today, thank you for your time. And on Sunday, remember, it's World Food Day. So please enjoy that. Thanks again.